Discuss the primary roles of occupational health nurses in high-risk industries such as construction. How do they contribute to injury prevention and compliance with workplace safety regulations? Answer: in high-risk industries like construction, OH&S play a pivotal role in ensuring worker safety and compliance with regulations. Key roles include injury prevention. OH&S assess the workplace for safety hazards, recommending measures to reduce risks like falls, equipment accidents, or exposure to toxic substances. They provide employees with training on safety procedures, proper use of PPE, and ergonomics. Health surveillance. They conduct pre-employment screenings, monitor employees' health through regular checkups, and ensure fitness for duty. Regulatory compliance. OH&S ensure the workplace follows OSHA standards, including those for fall protection 29 CFR 1926.501 and scaffolding safety 29 CFR 1926.451. They help track injury reports and maintain necessary documentation under OSHA's record-keeping rule 29 CFR 1904. Collaboration. They work closely with safety officers, industrial hygienists, and supervisors to implement and update workplace safety programs. Maria, an occupational health nurse at a manufacturing plant, is approached by an employee, George, who discloses that he has been diagnosed with a chronic condition requiring intermittent leave. George is concerned about job security and privacy. How should Maria address George's concerns while ensuring compliance with the Americans with Disabilities Act (ADA) and HIPAA? Answer: Maria should take several actions. HIPAA privacy. Maria should assure George that his medical information will remain confidential and that only necessary details will be shared with HR and management for accommodation purposes. HIPAA mandates that all medical records be kept private and only shared with those who need the information for the accommodation process. For ADA compliance, Maria should explain George's rights under the ADA, which requires employers to provide reasonable accommodations for employees with disabilities. These accommodations could include flexible work hours or adjusted duties. FMLA considerations. Maria should also inform George about his potential rights under the Family and Medical Leave Act (FLA), which provides eligible employees with unpaid job-protected leave. Documentation. Maria should document her interactions, ensuring all actions align with ADA and HIPAA requirements, and notify HR to proceed with an accommodation review. By following these steps, Maria can support George's rights and ensure the company remains compliant with federal laws. Analyze the types of hazards occupational health nurses must monitor in a chemical processing plant and the strategies used to mitigate these hazards. Answer: in a chemical processing plant, OH&S must monitor the following hazards. Chemical hazards. Exposure to hazardous chemicals like solvents or acids is a major risk. OH&S ensure proper PPE, respirators, gloves, and ventilation systems are in place. Regular monitoring of air quality and implementing emergency decontamination protocols are essential. Physical hazards. Workers may face noise, vibration, or extreme heat. OH&S mitigate these risks by instituting noise control measures, providing ear protection, and ensuring proper hydration and heat stress protocols. Ergonomic hazards. Repetitive motions and heavy lifting can lead to musculoskeletal injuries. OH&S advocate for ergonomic workstation design, encourage job rotation, and provide training on safe lifting techniques. Biological hazards. Employees may handle biohazardous materials. OH&S ensure proper vaccination programs, safe handling procedures, and availability of emergency first aid kits. All interventions align with OSHA's Hazard Communication Standard 29 CFR 1910.1200 to ensure safety in the workplace. Why is effective risk communication critical in occupational health nursing, and what are the principles that guide this practice? Answer: effective risk communication is vital in occupational health nursing because it helps mitigate workplace hazards by informing employees about risks and safety measures. This communication fosters trust and empowers workers to make informed decisions. The guiding principles are clarity. Information should be simple and accessible, avoiding jargon. It ensures workers understand the risks and preventative actions. Accuracy. Communication must be based on scientifically valid data, ensuring reliability and transparency. Empathy. OH&S must show sensitivity to workers' concerns, particularly when addressing emotional reactions to hazards. Consistency. Consistent messaging helps avoid confusion and reassures workers that their health is prioritized. By following these principles, OH&S help create a safer work environment, reduce anxiety, and enhance compliance with safety protocols. These practices align with the NIOSH's recommended practices for safety and health programs. Describe the role of occupational health nurses in managing workplace injuries under state workers' compensation laws. Answer: OH&S play a vital role in managing workplace injuries under state workers' compensation laws by immediate response. They provide first aid and initiate emergency protocols if necessary, ensuring prompt medical treatment. Documentation: OH&S complete injury reports, ensuring compliance with OSHA's record-keeping rule 29 CFR 1904. They document all details accurately for potential claims. Claims process: OH&S assist employees with the workers' compensation claims process by providing necessary medical records and tracking the treatment process. Return to work programs: they collaborate with physicians and employers to design return to work plans accommodating the employee's recovery needs while ensuring a smooth reintegration into the workforce. By managing injuries with accuracy and empathy, OH&S help reduce the risk of prolonged injury, facilitate faster recovery, and ensure compliance with state workers' compensation laws. Explain the ethical challenges faced by occupational health nurses when balancing employer and employee interests. Provide examples. Answer: OH&S face several ethical challenges when balancing employer and employee interests. Conflict of interest: OH&S must navigate the potential conflict between the employer's desire to minimize costs and the employee's right to receive comprehensive health care. For example, an employer may prefer a quick return to work program while the employee may require more time to recover. Confidentiality: OH&S must safeguard medical information under HIPAA while managing requests from employers for health-related information that could impact work performance. Advocacy: OH&S are ethically obligated to advocate for workers' safety even if it contradicts the employer's preferences. For instance, recommending modifications in work duties for a worker with a disability despite potential operational costs. These ethical dilemmas are guided by the AAOHN Code of Ethics, which emphasizes employee well-being and professional integrity. Critically evaluate the impact of workplace wellness programs on employee productivity and organizational outcomes. Answer: workplace wellness programs significantly impact employee productivity and organizational outcomes by reducing absenteeism. Programs focusing on physical activity, stress management, and chronic disease prevention have been shown to lower absenteeism due to illness. Enhancing employee morale. Wellness programs promote a culture of health, improving employee satisfaction and retention, lowering healthcare costs. By addressing health risks early, companies can reduce the long-term costs associated with chronic conditions such as diabetes or hypertension. Research suggests that effective wellness programs lead to a return on investment (ROI) as healthier employees are more productive and healthcare costs decrease. These programs align with Healthy People 2030 objectives and support a healthier workforce. What are the responsibilities of occupational health nurses in workplace emergency preparedness and response planning? Answer: OH&S play a crucial role in emergency preparedness by developing emergency protocols. OH&S must ensure that emergency plans are up to date, covering scenarios like chemical spills, fires, or medical emergencies. Training employees. They are responsible for conducting emergency response drills and training workers on evacuation procedures, first aid, and fire safety. Collaboration with authorities. OH&S work with local emergency services to ensure that external resources can be mobilized quickly during a disaster. Post-emergency care. After an emergency, OH&S provide follow-up care, ensuring employees receive necessary medical treatment and mental health support. These actions are in compliance with OSHA's Emergency Action Plan Standard 29 CFR 1910.38, which outlines necessary employer and employee duties during emergencies. Analyze the role of occupational health nurses in promoting mental health in the workplace. Answer: OH&S are integral to promoting mental health by identifying workplace stressors. OH&S assess workplace conditions that may contribute to mental health issues such as high workloads, poor management practices, or harassment. Providing support services. They offer counseling or employee assistance programs (EAPS) to employees struggling with mental health concerns, ensuring they have access to professional support. Stress management programs. OH&S can implement workplace stress management programs, offering resources like mindfulness sessions or flexible scheduling. Workplace culture. They advocate for a supportive work environment that values work-life balance, reducing mental health stigma and promoting employee well-being. These efforts align with the National Institute of Mental Health (NIM) guidelines, fostering healthier and more resilient workplaces. What are the key safety standards OH&S must enforce to ensure a safe working environment in high-risk manufacturing sectors? Answer: OHS must enforce the following key safety standards. Personal protective equipment (PPE). OHS ensure that all workers are equipped with the appropriate PPE, such as helmets, gloves, and respiratory protection, as per OSHA's PPE standards 29 CFR 1910.132. Hazard communication. OHS ensure that employees are trained in handling hazardous materials following OSHA's Hazard Communication Standard 29 CFR 1910.1200 and that proper labels and safety data sheets (SDS) are available. Machine safety. OHS ensure that equipment is regularly inspected and maintained to prevent accidents in compliance with OSHA's Machine Guarding Standard 29 CFR 1910.212. Emergency procedures. OHS help develop and regularly update emergency response protocols for fires, chemical spills, and other accidents. These standards help create a safe, compliant work environment, reducing the risk of workplace injuries and fatalities. Explain how occupational health nurses assess workplace air quality and outline the key methods and tools used for such assessments. Answer: assessing workplace air quality involves identifying airborne contaminants and measuring their concentrations to ensure compliance with regulatory limits and safeguard worker health. Key methods include direct sampling, using devices like personal sampling pumps or area samplers to collect air samples. Examples include charcoal tubes for organic vapors or filters for particulate matter. Real-time monitoring. Instruments like gas detectors or particle counters provide immediate feedback on contaminants like carbon monoxide or fine dust particles. Biological monitoring, measuring biomarkers in workers' biological samples, e.g., blood or urine, to assess exposure levels. Indoor air quality assessments, monitoring ventilation systems and measuring parameters like co-levels and humidity, which influence overall air quality. Relevant regulations include the OSHA Permissible Exposure Limits (PELs) and NIOSH Recommended Exposure Limits (RELs), which define acceptable levels for various substances. Additionally, standards like the American Conference of Governmental Industrial Hygienists (ACI) Threshold Limit Values (TLVS) guide preventive strategies. A factory uses asbestos in its insulation materials. Describe the regulatory requirements for managing health risks from asbestos exposure in the workplace and the OWN's role in ensuring compliance. Answer: managing health risks from asbestos involves strict adherence to regulations like the OSHA Asbestos Standard 29 CFR 1910.1001 and the EPA Asbestos Hazard Emergency Response Act (AHARA). Key requirements include identification and assessment, conducting surveys to identify asbestos-containing materials (ACMs) and their condition, exposure monitoring, measuring airborne asbestos fibers regularly to ensure levels remain below the permissible exposure limit (PEL) of 0.1 fibers per cubic centimeter (FCC) over an 8-hour time-weighted average. Control measures, implementing engineering controls such as proper ventilation and containment, and administrative controls like limiting access to asbestos areas. Personal protective equipment (PPE), ensuring workers use appropriate respiratory protection. Training and communication, educating workers about asbestos hazards through hazard communication programs. Mary, an occupational health nurse, observes a significant rise in respiratory complaints among employees at a manufacturing plant. Employees report coughing, shortness of breath, and irritation during specific shifts. Upon investigation, Mary learns that a nearby construction project is generating high levels of dust that may be entering the plant. What actions should Mary take to address this issue, and which public health and workplace safety principles apply in this situation? Answer: Mary should undertake the following actions. Conduct an exposure assessment. Use air sampling to measure particulate levels inside the plant and identify sources of dust intrusion. Engage stakeholders. Collaborate with the plant's management, workers, and the construction company to address the issue. Implement controls. Suggest engineering controls, such as improved filtration systems or barriers to limit dust entry. Educate workers. Provide training on recognizing dust-related symptoms and the use of protective measures. Notify authorities. If air quality remains poor, report the issue to relevant agencies like OSHA or the local public health department. The principles of source pathway receptor analysis and hierarchy of controls, elimination, substitution, engineering, administrative (PPE) underpin our approach. Compliance with OSHA's respirable crystalline silica standard ensures adherence to exposure limits. What are the key components of an effective employee assistance program (EAP) in addressing workplace stress and burnout? Answer: an effective AP includes counseling services, providing confidential support for stress, anxiety, and personal challenges. Mental health resources, offering access to trained therapists and self-help tools like mindfulness applications. Managerial training, equipping supervisors to recognize early signs of stress and intervene constructively. Crisis intervention, addressing acute workplace incidents such as layoffs or critical accidents promptly. Follow-up services, monitoring employee well-being and adjusting programs based on feedback. These initiatives are guided by principles in the Mental Health Commission of Canada's National Standard for Psychological Health and Safety, promoting a proactive, stigma-free environment. Explain how occupational health nurses can recognize and manage PTSD among workers exposed to traumatic events, referencing relevant frameworks. Answer: OHNS can recognize and manage PTSD by screening using validated tools like the PTSD checklist (PCL) to identify symptoms such as intrusive thoughts, hyperarousal, and avoidance. Referral, directing affected workers to mental health professionals specializing in trauma. Supportive work environment, advocating for reasonable accommodations such as flexible schedules or modified duties. Education, training employees and supervisors to understand PTSD and reduce stigma. Follow-up, monitoring recovery progress and adjusting interventions as needed. Frameworks such as the Diagnostic and Statistical Manual of Mental Disorders (DSM-5) and WHO Guidelines on Mental Health at Work provide evidence-based approaches to PTSD management. James, a warehouse supervisor, reports the subordinate, Alex, has exhibited erratic behavior, including frequent absences, withdrawal from colleagues, and moments of visible distress. Recently, Alex confided about being a victim of workplace bullying. What steps should the occupational health nurse take to address this situation, and which regulations or guidelines support their actions? Answer: the OHN should conduct a private assessment, meet with Alex to understand the bullying context and its impact, implement immediate protections, ensure Alex feels safe at work, potentially involving HR or a neutral mediator, investigate, collaborate with HR to investigate the bullying claims confidentially, provide support, offer mental health resources or counseling services through the EAP, monitor workplace culture, recommend training on respectful workplace practices to prevent future incidents. These actions align with OSHA's general duty calls requiring a safe workplace and anti-bullying principles outlined by the Workplace Bullying Institute, WBU, and local labor laws. Discuss the health risks of lead exposure in the workplace and the preventive measures that occupational health nurses should implement. Answer: lead exposure in the workplace, especially in industries like construction, battery manufacturing, and painting, can lead to serious health risks, including lead poisoning, which can cause neurological, renal, and reproductive damage. Workers exposed to lead are at risk of symptoms such as abdominal pain, fatigue, headaches, and cognitive impairments. Preventive measures include exposure monitoring, regular blood lead level tests, and environmental air sampling to monitor exposure levels. The OSHA permissible exposure limit (PAL) for lead is 50 of blood lead. Engineering controls, implementing proper ventilation systems and wet methods for cleaning surfaces to reduce dust. Personal protective equipment (PPE), recommending the use of respirators, protective clothing, and gloves to reduce dermal exposure. Hygiene facilities, providing washing stations and ensuring workers do not eat or drink in contaminated areas. Health surveillance, regular medical examinations, including blood lead tests and monitoring kidney function. What are the key considerations in conducting a community health impact assessment (CHIA) in an occupational setting, and why is it important? Answer: a community health impact assessment (CHIA) is a process that evaluates how workplace activities, particularly those involving environmental hazards, might impact the health of nearby communities. Key considerations in conducting a CHIA include identifying stakeholders, engaging local health departments, community leaders, and workers to gather input on potential concerns. Data collection, gathering data on air and water quality, health outcomes in the community, and local environmental conditions. Hazard identification, identifying potential risks posed by workplace emissions, such as toxic chemical releases or noise pollution that might affect the surrounding community. Health outcomes, assessing both short-term and long-term health effects on the local population, particularly vulnerable groups like children or the elderly. Mitigation strategies, proposing measures to reduce adverse impacts, such as reducing emissions, enhancing workplace waste management, or improving the community's access to health services. A CHIA is important because it helps prevent negative health impacts, aligns with public health regulations, and fosters collaboration between industries, workers, and the community. How should occupational health nurses use screening tools to assess workplace stress and burnout? Answer: OHS uses screening tools to identify early signs of stress and burnout to help mitigate long-term health issues. Common screening tools include the Maslach Burnout Inventory (MBI), a widely used tool to assess emotional exhaustion, depersonalization, and personal accomplishment. It helps to identify individuals at risk of burnout. The Job Stress Survey (JSS). This tool assesses work-related stresses, including role ambiguity, workload, and organizational support. The Perceived Stress Scale (PSS), a general tool to assess the level of perceived stress, helping identify those who are feeling overwhelmed by their work environment. The Copenhagen Burnout Inventory (SBIA) measures physical, emotional, and mental exhaustion related to work. The results of these tools should guide OHS in implementing interventions such as workload management, promoting regular breaks, and recommending counseling services. Additionally, they can provide psychosocial risk assessments to align with ISO 45003, which outlines how to manage mental health in the workplace. David, an office worker, has been working overtime for the past 6 months. He feels constantly fatigued, has trouble sleeping, and is starting to experience irritability at work. He confides in the occupational health nurse that he feels overwhelmed by his workload and doesn't know how to manage his stress. What actions should the occupational health nurse take to help David, and which key principles should guide the nurse's approach? Answer: the occupational health nurse should take the following steps. Conduct a stress assessment. Use a validated screening tool such as the Perceived Stress Scale (PSS) or Maslach Burnout Inventory (MBI) to assess the severity of David's stress levels. Offer counseling. Provide immediate emotional support and recommend David access to an employee assistance program for further counseling and coping strategies. Review workload management. Collaborate with David's supervisor to review workload demands, set realistic expectations, and potentially adjust deadlines. Promote work-life balance. Advise David on stress reduction techniques such as mindfulness or physical activity, and encourage taking regular breaks and time off. Monitor progress. Arrange a follow-up meeting to assess David's well-being and determine if additional support is needed. This approach aligns with the National Institute for Occupational Safety and Health (NIOSH) guidelines, which emphasize creating a supportive work environment that prevents burnout and supports mental health. Explain why cultural attitudes toward health and safety might impact the effectiveness of workplace health programs. Discuss strategies to address these challenges. Answer: cultural attitudes significantly influence how employees perceive workplace health and safety programs. In some cultures, individuals may prioritize collective well-being over personal health, while others may see health concerns as a private matter. Additionally, stigma associated with mental health in certain cultures can deter employees from participating in workplace mental health initiatives. Strategies to address these challenges include cultural sensitivity training, educating staff and management about cultural differences to foster an inclusive environment. Multilingual communication, translating materials and using visual aids to overcome language barriers. Tailored programs, designing health initiatives that consider cultural preferences and taboos such as dietary restrictions or gender-specific care preferences. Relevant guidelines. OSHA's workplace diversity best practices emphasize incorporating cultural competency in health and safety plans. Maria is a new immigrant working in a manufacturing plant. She speaks limited English and has not been participating in safety training sessions because she struggles to understand the material. This has led to repeated minor safety violations. What should the occupational health nurse do to address this issue? Answer: the OHN should implement the following steps. Conduct a needs assessment. Determine Maria's specific language needs and any cultural factors influencing her understanding. Provide multilingual training. Offer safety training in her native language or use interpreters. Use visual tools. Include diagrams, videos, and demonstrations to enhance comprehension. Peer support. Pair Maria with a bilingual coworker to act as her mentor. Relevant guidelines. The Equal Employment Opportunity Commission (EOC) mandates reasonable accommodations for language and cultural differences to ensure equal access to safety resources. OSHA advises using pictograms and nonverbal communication tools in workplaces with language barriers. Describe the steps involved in conducting an ergonomic workstation assessment and explain the role of biomechanics in this process. An ergonomic workstation assessment includes: identify tasks, observe and list the tasks performed by the employee, analyze postures, assess the employee's body positions and movements during work, evaluate workstation setup, Check the height of desks, chairs, and monitors, and the reach required for tools. Assess environmental factors. Consider lighting, noise, and temperature. Provide recommendations. Suggest adjustments such as ergonomic chairs, sit-stand desks, or repositioning monitors. Role of biomechanics. Biomechanics focuses on understanding how forces interact with the human body. In this context, it helps minimize repetitive strain injuries by analyzing the mechanics of movements, ensure tools and equipment support natural body alignment, optimize workstation layouts to reduce awkward postures, discuss the risks of prolonged sitting for sedentary workers and propose evidence-based interventions to mitigate these risks. Answer: risks of prolonged sitting. Increased risk of musculoskeletal disorders, particularly lower back pain, higher likelihood of cardiovascular disease due to reduced circulation, potential for obesity and metabolic syndrome, evidence-based interventions, introduce sit-stand workstations, allow workers to alternate between sitting and standing, encourage regular movement, recommend short breaks every 30 minutes to stretch and walk, provide ergonomic furniture, use chairs with lumbar support and adjustable armrests, educate workers, train employees on proper posture and movement exercises, relevant guidelines. OSHA's recommendations for office ergonomics suggest frequent breaks and proper seating arrangements. The American Heart Association endorses movement every 30 minutes to counteract the risks of sedentary behavior. How can an occupational health nurse create a culturally competent health and safety program for a diverse workforce? What factors should the OHN consider to ensure inclusivity in the program's design? Answer: to create a culturally competent health and safety program, the OHN should focus on the following factors. Cultural assessments. Understand the cultural demographics of the workforce, including their beliefs, attitudes toward health, and language needs. Inclusive language. Use language that is inclusive and respectful of all cultures, avoiding terms that may be culturally insensitive. Tailored health initiatives. Customize programs to accommodate different cultural practices, such as dietary preferences, religious observances, and work-life balance needs. Employee engagement. Involve employees in the planning and development of health programs to ensure that they resonate with diverse cultural backgrounds. Accessibility. Ensure that health communications are available in multiple languages and accessible formats, including visual aids and video demonstrations. Relevant guidelines. The Office of Minority Health National CLAS Standards. Culturally and linguistically appropriate services. David, a warehouse manager, is noticing that his team, primarily composed of workers from different cultural backgrounds, is struggling with interpreting safety instructions. He observes that there are misunderstandings that lead to minor accidents. What actions should David take to improve the situation? Answer: David should consider the following actions. Conduct a cultural sensitivity workshop. Organize a session to discuss the importance of understanding cultural differences in safety practices. This would help workers appreciate diverse perspectives and improve collaboration. Language support. Provide safety instructions in the languages spoken by the workforce. This could involve hiring interpreters or using technology that translates written materials, visual aids. Integrate images, videos, and infographics into the safety training to overcome language barriers and clarify complex instructions. Peer mentoring. Pair experienced workers with those who may struggle with understanding, facilitating learning through direct engagement. Relevant guidelines. The Equal Employment Opportunity Commission (EOC) provides guidelines to ensure workers from diverse backgrounds have access to equal training and development opportunities. OSHA recommends using multimodal communication methods e.g., written, oral, and visual in safety programs to accommodate diverse learning styles and languages. Explain the importance of biomechanics in reducing injury risk for workers who are required to lift heavy objects regularly. What specific principles should be applied to minimize strain on the musculoskeletal system? Answer: biomechanics is crucial in reducing injury risk because it helps identify movements that put excessive strain on the body. Key principles to apply include body alignment. Maintain neutral spine alignment by avoiding twisting or bending at the waist. Encourage workers to squat with their knees bent and their feet shoulder width apart, using the legs for lifting rather than the back. Load distribution. Ensure the heavy loads are kept close to the body to reduce leverage and strain. Avoid overreaching. Position the object at a height that allows for lifting without extending the arms excessively, using mechanical aids. Encourage the use of lifting devices like forklifts or conveyors to reduce manual handling. Training. Provide proper lifting technique training and ensure regular reminders for workers to use safe methods. Relevant guidelines. OSHA's manual material handling guidelines emphasize the importance of ergonomically designed tools and equipment to reduce injury unnecessary risk during lifting. What role does ergonomics play in designing office furniture and workstations, and how can incorrect workstation setup lead to health issues such as repetitive strain injuries, RSI, and musculoskeletal disorders (MDR)? Answer: ergonomics plays a key role in designing office furniture and workstations to promote comfort, reduce physical strain, and support overall well-being. Proper ergonomics helps avoid RSs and MSDS by addressing desk height. A desk that is too high or low can force workers to bend or stretch awkwardly, leading to strain on the back and arms. Chair design. Chairs should offer lumbar support to support the lower back and allow for a neutral sitting posture. Monitor placement. The top of the monitor should be at eye level to prevent neck strain, and the screen should be about an arm's length away to avoid eye strain. Keyboard and mouse position. These should be positioned to allow for relaxed shoulders and wrists. Elevated wrists while typing can lead to carpal tunnel syndrome, movement and breaks. Ergonomically designed workstations should facilitate movement by encouraging regular posture changes and breaks to reduce muscle fatigue. What specific interventions should an OHN suggest to reduce the risk of musculoskeletal disorders (MSDS) in employees working with repetitive tasks such as assembly line workers? Answer: to reduce the risk of MSDS in workers performing repetitive tasks, an OHN should recommend job rotation. Rotate employees between different tasks to prevent prolonged repetitive motion and reduce fatigue on specific muscle groups. Task redesign. Modify tasks to reduce unnecessary repetitive movements, for example, by using automated tools or machines to assist in tasks like lifting or moving materials. Ergonomic tools. Provide ergonomic tools such as power tools with adjustable handles or vibration-reducing gloves to reduce strain on the hands and arms. Rest breaks. Implement scheduled breaks to allow workers to stretch and relax their muscles, which can help reduce muscle tension and fatigue. Posture training. Educate workers on maintaining good posture during repetitive tasks to reduce stress on their joints and muscles. Relevant guidelines. OSHA's ergonomics program and the NIOS H-lifting equation suggest regular breaks and job rotation to reduce MSD risk in repetitive tasks. What other key strategies an occupational health nurse owner can use to address language barriers in the workplace, and how can this impact the effectiveness of health and safety communications? Answer: to address language barriers in the workplace, the OHN can use the following strategies. Multilingual materials. Provide health and safety communications in the languages spoken by employees. This can include printed materials, posters, and safety instructions. Interpretation services. Offer real-time interpretation services during safety meetings and health assessments to ensure that non-native speakers fully understand the information being conveyed. Bilingual staff or peer support. Hire bilingual staff or identify employees who can assist in translating and explaining health and safety information to their colleagues. Use of technology. Implement technology such as translation apps or tools to assist with communication. Visual aids. Incorporate visual aids such as pictograms, diagrams, and videos that transcend language barriers and clearly depict safety procedures. Impact. Addressing language barriers can significantly improve the effectiveness of health and safety communications. When employees understand safety procedures and are able to ask questions in their native language, they are more likely to follow safety protocols, reducing the likelihood of accidents and injuries.